Hi, I'm Dr. Shraddha, Dermatologist at Helios Advanced Skin, Hair and Laser Clinic. And today being World Leprosy Day, we will clear a few doubts on what leprosy is, how it is transmitted, what are the symptoms and how one can treat leprosy. So, what is leprosy? Leprosy is a bacterial disease that is caused by a Mycobacterium leprae. Leprosy is a chronic condition, it's a chronic infective disease. Now it mainly affects the skin and the nerves. But in the later stages or when the bacterial load is very high, if it is neglected, then it can affect the other organs also, like the eyes, and it can also affect the kidneys, it can affect any other organ of the body. When you get leprosy, how does it look like, or what are the symptoms? So the first commonest thing that we come across is patches, that is whitish patches. We say hypopigmented, whitish patches on any part of the body, on mostly the hands. It can occur on the face, legs, anywhere, which does not have sensation. We call it anesthetic or hyposthetic hypopigmented patches. Now when these patches are seen, it is essential that you see a dermatologist to rule out leprosy. Now this is the stage when your immune system is good. So if the immune system is good, you will have one or two patches which present like this, and at this stage it's quite easy to detect and treat the patient. Now there is another spectrum called the lepromatous spectrum, where the bacterial load is very high. That is, when your immune system is not good enough, it does not fight against the bacterial load becomes very high, and that's when you start getting raised bumps on the skin, or you don't get these white patches, but you can get loss of sensation on your hands or even feet. Sometimes if you notice, the ear lobes also become thickened. So in such instances, it means you have a high bacterial load, and this is the time when one can be infective to others. So how does leprosy infect others, or how does one get leprosy? Is if you come in contact with people with high bacterial load, then it can come through airborne contact or direct contact when you touch open wounds or ulcers. So this is how one can get leprosy. When do you come and see a doctor? If you are suffering from leprosy, you will not know that you have this disease. So if you notice any whitish patches, especially when you feel there is a different sensation or reduced sensation in a particular patch, or if your hands and feet don't have enough sensation, or if you find any abnormal patches on the earlobes, then or if you even sometimes feel some cord-like structures on the neck or the elbows, that means the nerves are getting thickened. So you must see a dermatologist. So leprosy can be treated. There are very good drugs to treat leprosy, but the key here is early detection and taking the drugs for the stipulated period of time, because if you stop the drugs early, then you might not adequately treat the infection and it may relapse. So it is important to see your doctor. There are 3-4 drugs that has to be, it depends on which spectrum of disease that you fall under, whether it's low bacterial load or higher bacterial load. Your treatment regimen will depend on that. And there are some people who are allergic to certain medications. So in such instances, the doctors will opt for a second line of drugs. So what can you expect after treatment of leprosy? So once you get treated, the existing patches or existing areas where the nerves have been damaged will not recover completely. So do not expect the patch to completely disappear, or the lesions to become, or where there was loss of sensation, to completely become normal. The aim of treatment is to cure the disease and to prevent further spread. The existing areas where it has been damaged will remain that way. It may improve, but it may not completely go. The next thing is, if the patient is in the high bacterial load spectrum, we call it the lepromatous spectrum, where they have already lost sensation over the hands and feet, they may not get that sensation back even after treatment. So in such instances, one must take care of their hands and feet, protect their hands and feet, because they won't have the pain sensation. So wear gloves, they should not walk for long distances, they should take rest appropriately when they need to stand for long hours, and every night before they sleep they need to examine their hands and feet. So the theme for this World Leprosy Day is Beat Leprosy, and it is a completely treatable disease. So do see your dermatologist on time, and there is a lot of stigma involved with this disease, and that need not be the way. It is completely treatable. So let's be kind to patients who've been affected with leprosy, and there is a lot of stigma associated with leprosy. It need not be that way. We have to help patients who have been affected by leprosy, and if they have enough damage, we must do what we can to rehabilitate them.